So now we'll get to hear from Daniel Hunt, Dr. Daniel Hunt and Nadia Rind, in regards to improving access to eye services for Aboriginal people living on or visiting Wadjuk Noongar Boodja. So Dr. Daniel Hunt is the Deputy Medical Director and Nadia Rind is the Aboriginal health practitioner working at the Derbarl Yerrigan, and they will tell us about how Derbarl Yerrigan Health Service has been working to increase access to optometry and ophthalmology services within an Aboriginal community-controlled health organisation. So if you could please join me in welcoming them.
Good morning. Firstly, I'd like to give apologies for Nadia. She is unable to make it today. She's a great mum, so she's got a sick kid, so she's looking after him today. So unfortunately, you've just got me. So so I'm just going to talk about what we do at my workplace. But firstly, I'd like to acknowledge that we're meeting on Wadjuk Noongar Boodja. I'd like to acknowledge elders past, present and emerging, Indigenous people in the room, and most importantly, the patients whom we look after. And a little bit about myself. I'm the Deputy Medical Director of Derbarl Yerrigan. I'm a Jaru Nichibandi. Well, I've got to staying man. I always say boy, but I'm getting quite old now. So I'm a Jaru Nichibandi man and have been at Derbarl for about 7 years in varying roles now. So, eye health for Aboriginal people in Australia, it is not great, as we sort of elicited. And the last time I looked at stats, there was 6 times the rate of blindness compared to non-Aboriginal people. And I think we just had some other stats this morning that say it's now about 3. So this is obviously some improvement. But, 94% of vision loss in Aboriginal people are preventable. So, cataracts, retinopathy, trachoma. So it's obviously if it's preventable, it must be easy in one way, shape or form. And it's probably requires a little bit more investment from our government colleagues. But this is 2 of our Aboriginal health practitioners. On your right is Nadia. She's the specialist coordinator and she looks after anything to do with eyes at Derbarl. And that keeps her quite busy. But first I'd like to say that, we've got a little quote from the Royal Commissions into Aboriginal Deaths in Custody. And it stated basically a high level of lack of compliance by Aboriginal people should be a warning sign to healthcare service personnel and administrators that problems may exist in their own styles of operating. And I totally agree with this statement. Constant we're saying, not we, people tell us it is the patient's fault, that it is their reasons. They are not, but it can't be their fault if it's a population issue. If it's a population issue, it's a failure of the systems, it's a failure of the government. Consistently, I was in a little chat last week with someone from at the Communicable Diseases Conference, and they were having a go at me about the immunisation rates in the community, and they're at about 9.5% rate for influenza. And I said, well, that's not a patient failing, that's a failure of the government to actually have appropriate access. And that's my opinion. I don't think any of our patients are to blame because there is no patient out there who wants to have poor health outcomes. So this is a little picture by Cindy, one of our staff that used to work at Derbarl. And she did this painting and basically put culture at the centre of everything we do. We're 4 distributed clinics, so you can see the 4 distributed clinics, and that the footsteps represent the journey that our patients are on from a cultural and health and social point of view. And so that sort of wraps up what all the ACCHS do, so that we centre ourselves around our patients and our culture and the health journeys of which our patients are on. And so, I'm from Derbarl Yerrigan Health Services. We're 50 years old and we've got about 17,000 patients and we're distributed across 4 clinical sites, and we're not doing too bad with what we do. We've got about 14 visiting specialists. We've got a host of allied health programs, and I always have to say this, in 2023 we were the WA GP Practice of the Year. So I think that's quite a... Thank you. So with our patients, every patient that comes through our service is screened by an Aboriginal health practitioner RN prior to seeing the GP. And so that's basically they get their screen, they get their blood pressure checked, HbA1c, ACRs, any of those point of care tests, or and a reasoning of why they're presenting to the clinic. And Our AHPs operate clinically and as a specialist coordinator. And then again, there's Nadia doing a retinal photography on one of our staff who's kindly posted for the picture. But yeah, they're all our AHPs are trained in retinal photography, and we essentially try and get that as part of our, if not the screening process, the return to the AHP for retinal photography. And this is all through our partnership with Dr. Turner. He's been helping us out since 2010, and I think 2018 when Lions Outback came on board. So we've been very busy in this space. So we host an optometry clinic at Derbarl, and we just provided some of the numbers. So as you can see, the need is just increasing. You know, our numbers for so far this year are on par with our 2022 numbers. So it's just increasing need for access for basic optometry, so just the basics that our patients can see. And so we've got a reasonable attendance rate with our clinics, and our numbers are only ever increasing. So yeah, that's something to keep an eye on. Now, spectacle dispensing is, you know, that should be one of the easiest things we do, and as we've pointed out today, it seems to be fairly difficult Australia-wide to provide glasses. We do also have our ophthalmology clinic that works out of the East Perth clinic. So we did purchase the OCT machine and a retinal photography machine. So since 2020, we've done 4,900 retinal photographs and 2,700 OTC exams. And that also includes, since 2017, we've seen over 2,500 patients and done about over 500 injections. So this is a clinic that runs monthly, and the monthly clinic's just to say basically so we can get those intravitreal injections into our patients and stave off diabetic retinopathy. We've also had some interactions with artificial intelligence. So we had access to an artificial intelligence to help basically detect retinal disease in patients, and these software can do it better than an ophthalmologist, which is quite impressive. And so I think currently the software that Google owns is the best that we've got going out there. So we're just looking into how Angus and his team are looking into how this artificial intelligence technology can be utilised in clinical practice. And you know, this is sort of moving forward, some of the future that we're looking into, and hopefully one day we can have a you know, almost a test and treat model of care, diagnose with retinopathy on the day and get someone to do an intravitreal injection and get the ball rolling. That's probably the future of where we're going. So ultimately, what we need to really focus on is clinical best practice. We need to ensure that the work is done culturally safe and respectful. You know, that's why we have the outreach clinics in Derbarl. We have the ophthalmology clinics coming to Derbarl. We have it run by an Aboriginal health practitioner because we need to sort of really recognise that this is probably the best model of care that exists. Accessing a tertiary service or hospital does not work for our patients, and it works very well for our patients having it under our roof. Our paediatric developmental service, it's about 20-40% attendance rate in the public service. Our service is a 98% attendance rate. So that kind of model just really works for our patients, and it looks after our patients well. And yeah, so we just need to basically look at providing, and this is what Derbarl does, and I think we do it very well. We provide a culturally safe care. All our stuff is delivered under our roof. It's culturally appropriate and comprehensive. We have Aboriginal health practitioners. Our reception are staffed by our Aboriginal staff members. We have 5 Aboriginal general practitioners at our service, and our role is to continue to support patients through their healthcare journeys. And you know, with that, doing our Aboriginal health practitioner model of care, which will include being seen by them, getting the retinal photography done, and any other healthcare needs met, and make it a really wraparound and culturally safe service. So yeah, basically, I just want to finish by saying that we need to stop problematising Aboriginal people as they're frail, weak, sick, and consider the factors that actually prevent them from accessing the services, because those are the real disparities that exist. And then in the future, we need to look at, yeah, as I mentioned, the AI technology could revolutionise our practice. change our hospital model of care, get the specialists out of the hospitals and into our services where they can provide better, clear-cut care to our patients, and to go on at addressing the social and economic determinants of health, and also funding. Closing that gap is great, and that's a great buzzword, but that gap can really only be closed by the government actually putting their hands in their pockets appropriately and funding. I think there's some government guys over there. Hi. Thank you.